is just reporting on a quality improvement project that we completed here at Odette last year. And our project was on improving the cultural inclusivity in the management of radiation-related skin reactions. So just starting with some objectives, the objectives of today's presentation include 1, identifying how skin reactions manifest in patients of darker skin tones, 2, incorporating inclusive practice into our daily patient interactions, and 3, recognizing how QI projects can improve the quality care of our patients. So I first wanted to mention a student project that was completed by Eden and Dale, so one of the radiation therapists here at Odette. Eden's student project looked at a systematic literature review, and it aimed to provide a consensus on the relationship of race on radiation-induced skin reactions. So through a project, they reviewed multiple databases. So this included PubMed, Medline, and CINAHL. They had 653 papers from their initial search. And after they removed about 127 duplicate papers, they had 477 papers remaining, which they then screened by title, leaving about 18 papers. So from those 18 papers, 11 of them did not fit their inclusion and exclusion criteria. So therefore, they had a total of 7 papers that they evaluated. From the papers that they looked at, they saw that 6 out of the 7 reported that Black breast cancer patients experienced more severe skin toxicities from radiation treatment versus their Caucasian counterparts. And what's also showcased through our project here was the lack of studies and literature on the influence of skin tone on skin reactions. So this is kind of what's led to our quality improvement project initiative that we did here. So I did want to acknowledge that our project was completed, as Darby mentioned, through the TAS&P Innovation Fellowship. So this fellowship allows healthcare professionals across the TAS network, so this includes Sunnybrook, to lead a quality improvement project within their department. And the aim, of course, being to improve patient and family care here at Sunnybrook. So allotted for 2 days of protected time, so outside of clinical hours, taken out of clinical hours over a period of 6 months. And this is so that we could attend seminars on the quality improvement process, as well as implement these learnings into our own specific projects and initiatives. So a little bit of our background. So as most of us know here, acute radiation skin reactions are a common side effect we see in radiation therapy, especially in the head and neck and breast population. However, the clinical presentation, timing, and severity of these reactions hasn't been extensively studied across varying skin tones. So through our research, one of the things that we found was a commentary published by Julka Anderson, and this was done in 2023. And this looked at structural racism in our skin toxicity scoring systems. So one example they discussed in this commentary was the RTOG skin grading system shown here on the right. It discussed how it was first developed for patients of lighter skin tones, and darker skin tones being added more recently with little research and evidence. It also went on to discuss terms such as erythema, which we know translates to redness, and these terms don't always apply to patients of darker skin tones as they present differently from radiation. And then as we know, then patients of lighter skin tones are then the most often primary reference in our clinical education. So this is what's led to things like our assessment tools and educational resources being primarily aimed at this population. So this leaves healthcare providers with limited information when dealing with skin reactions for patients of darker skin tones. So here I just wanted to pull up 2 images to highlight the difference in the presentation of skin reactions based on skin tone. So we can see both these patients received radiation therapy to the head and neck area. We can see the patient on the left has a lighter skin tone and a more noticeable reaction. So they have that pink red hue across their entire neck. Whereas if we look at the patient to the right who has a darker skin tone, they present a little bit more subtly with more of a darkening of the skin, and their skin reactions a little bit more understated, a little less visible to the naked eye. So then from here, we looked a little bit more into the literature. So we found this study conducted by Ryan et al. In 2007, which found that post-treatment skin reactions reported by cancer patients differed by race and not by the treatments or the expectations of patients. So this study here looked at 656 cancer patients across the United States. These patients were asked to complete a symptom inventory that assessed 12 different symptoms, 2 of which included pain and skin problems. And they looked at this both before and after radiation therapy, before and after chemotherapy, and before and after radiation combined with chemotherapy. So the results of this study found that there was no significant difference between Black and white patients in their pre-treatment expectations of skin problems. However, once treatment was complete, they found that Black patients, about 56% of them, reported more skin problems than white patients, which only had 23%. And these results were found to be statistically significant. They also found in this study that Black patients reported severe skin reactions in their treatment site. So we had about 20% of those versus they had 8% in the white population. And this is shown here on the image to the right. These results were also found to be statistically significant. And the final conclusion from the study was also a direct link that they found between pain in the treatment site area and the severity of skin problems, which again was statistically significant. So the reasons as to why skin reactions might differ based on race has been examined in only a few studies. So this one's taken from one conducted by Lee et al. From 2019. This specific study looked at 366 cancer patients who had undergone breast radiation therapy. They were evaluated for pain using the brief pain inventory shown here on the right, and they evaluated pain both pre and post radiation therapy. So the results from this study here, they found that African-American women had a greater proportion of elevated inflammatory cytokines. So this included both CRP and interleukin-6. They also saw there was an increased frequency of pain in these African-American women, both pre and post radiation treatment. So the study was actually able to showcase a significant correlation between these elevated CRP levels pre-radiation treatment and reported pain from these patients. So this may explain in part why African-American patients experience more cancer treatment-related symptoms such as skin toxicity. So I also wanted to highlight here a patient testimonial that we found through our research. So this is taken from a blog by Amina for Life. She shared her perspective as an African-American woman who received radiation treatment for breast cancer. She spoke on the lack of information on skin reactions for patients of darker skin tones undergoing radiation. So one of the quotes that particularly stood out was this one here. Women of color are particularly susceptible to this oversight because many wrongly assume their skin will not be as severely involved due to increased levels of pigment or melanin. So we can see based both from the literature as well as here from the patient perspective, there was a clear gap in the information and language on skin reactions that was currently being given to patients, especially those who had a darker skin tone. So after the literature search was complete, we went on to assess the current state here at Odette. So these were the patient education materials. On the left, we can see for breast treatments, on the right for head and neck. And they included information on skin reactions. And the key phrase that I wanted to highlight here, which is similar in both pamphlets, is your skin may turn red. So as the statement doesn't reflect the experiences for patients of darker skin tones, we look to update these pamphlets through our project here. And this is what had led into both our purpose and aim for our project. So our project's purpose was to evaluate the perceptions of both patients and healthcare providers on the inclusivity of the education that we're providing on skin reactions at our institution, so here at Odette. And then our aim was to increase the awareness of side effect management, so specifically skin reactions, in patients of varying skin complexions being treated for both head and neck and breast radiation therapy, again here at Odette, and we had an aim of increasing this by 25% by March 2024. So a little bit into the methodology. So to establish a baseline, we first distributed patient surveys. So this was both to head and neck and breast cancer patients who had received at least 10 treatment fractions, and they had at least a total of 15 treatment fractions prescribed. In the survey, patients were asked to self-report their skin tone using the SASTP tool, which is the self-assessment skin tone palette tool shown here on the right. So we can see here that there's 9 different skin tones. The 3 on the top are the lightest in tone, so A1 to A3. The 3 in the middle, B1 to B3, were medium tones. And then the 3 at the bottom were C1 to C3, which was the darkest in skin tone. So patients were just asked to circle which skin tone closest resembled their own. So then within our patient survey, patients were given 5-point Likert statements, and this was to gauge their awareness on radiation-induced skin reactions. The statements that we had provided for patients were modified based on the standard health literacy questionnaire. And some of the statements that patients were asked to answer were these ones here. So one of them being, there was at least one healthcare professional on my team who I felt I could ask questions regarding skin reactions during my radiation treatment. We also evaluated if patients had received the written educational material on skin reactions, so either the breast or head and neck pamphlet that I mentioned. And then the ones that did, they answered additional statements, which included, I can read and understand the information in the skin reaction pamphlet, as well as I can accurately follow the written instructions given to me in the skin reaction pamphlet. So this is what allowed us to update the skin reaction pamphlet, which we did later on in the project. So for our baseline patient survey results, we had a total of 34 patients respond. We had 14 of those patients self-report skin tones between A1 to A3, so the lightest in tone. Another 14 report between B1 to B3, so that was our medium skin tone. And the last 6 patients reported between C1 to C3, so our darkest in skin tone. So this graph here is just highlighting another statement that patients were asked to answer, which was, I have enough information to help me manage possible skin reactions that may occur during and or after my radiation treatment. So we can see from the graph here, we had 50% of the patients, or 3 out of the 6 patients, who reported skin tones in the darkest skin tone category, C1 to C3, feeling like they were unsure if they had the information they needed to help manage possible skin reactions. And this is in contrast with only 7% of the patients in the lightest skin tone category, A1 to A3, feeling this way. If we also just look at the far right on the graph, we can see the largest cohort of patients that strongly agreed with the statement, so really felt like they had the information they needed, whereas again, those patients are the lightest skin tone category, so the A1 to A3 patients. So this graph here looked at the patients that did receive the previous written educational material on skin reactions, and they were asked if they felt the information in this written pamphlet was relevant to them. So here on the right side of the graph, we had 100% of those patients report skin tones between A1 to A3. So again, the lightest tone, feel like the information was relevant to them. So this is based on the patients that either agreed or strongly agreed with the statement. We had 80% of those patients in the medium skin tone category, so B1 to B3, feeling like the information was relevant to them. And finally, we had 67%, or 2 out of the 3 patients in the darkest skin tone category group, C1 to C3, feeling this way. So we could see that there was a decrease in the relevancy of information that was being given to patients of the darkest self-reported skin tones. So the second aspect of our project was looking at the perspective of healthcare providers. So we had distributed online surveys using SurveyMonkey to the radiation therapists here at the department. And this was to evaluate their current educational practices with respect to skin reactions. And we distributed these surveys between November to December 2023. Within the surveys, we also evaluated the frequency of the skin reaction pamphlet distribution, as well as the timing. So whether therapists were giving this at the start of treatment during our new patient teachings, in the middle of treatment, at the end, or as required. Therapists were also given 5-point Likert statements. So some of the ones they were asked to answer are outlined here. I'm aware of the differences of how skin reactions present based on patient skin tone. Another statement was, I tailor the verbal information that I give to patients on skin reactions based on their skin tone. So the results from our radiation therapist baseline surveys, we had 36 respondents from approximately 100 treatment floor radiation therapists, which are the therapists that are primarily involved in skin reaction assessment as well as education. So we had a 36% response rate to this. So of the therapists that responded, we had 72% of them believe that our current patient teachings and educational resources at Odette were not inclusive of patients of varying skin tones. And 86% of them stated that they would find it useful to learn more about how skin tone affects radiation-related skin reactions through an in-person education session. So this here revealed that the radiation therapists in the department were not as confident when assessing skin reactions in patients of darker skin tones. So this is what then led into our interventions or our change ideas of the project. One of which was here, updating the skin reaction pamphlet to include the relevant and accurate information required for patients of darker skin tones. So this is the new skin reaction booklet that's available for patients to take in the Pearl as well as here upstairs in nursing, and it's applicable to all treatment sites. I just wanted to highlight the language that we included here for patients of darker skin tones, where we can see in the mild description, we also included the term pink and dark to describe potential skin reactions caused by radiation. And then the second change idea that we implemented were the microlearning sessions. So these were 15-minute sessions that we held with the radiation therapists here at the department. And these sessions went over things like the existing literature, gaps in information, an interactive case study, as well as tools for radiation therapists that can be used during their patient interactions. So we had really positive feedback from our microlearning sessions. We had 62 radiation therapists attend, and 62 of them answered our post-session surveys. And from the therapists that attended and answered, we had 95% of those therapists state that they would change their daily practice after the session. 85% of the therapists stated they learned something new about skin reactions, and another 87% felt like it changed their perspective on skin reactions and how they differ based on patient skin tone. We also had included a free text section where we had one therapist state, "As a new radiation therapist, I found this information to be eye-opening." So as I mentioned, our microlearning sessions included a case study, so that's depicted here on this slide. So this case study is taken from that same paper published by Joka Anderson in 2023. So here they discussed the experience of a Black patient who was receiving head and neck radiation therapy. In the patient's consent process, they were actually advised to look out for redness in their skin as a sign of a skin reaction. And after the patient went on to receive about 22 treatment fractions or 47 gray, they had patches of moist desquamation across their neck, and they described their skin feeling like it was on fire. However, by this point, the patient had scored an RTOG grading of 0 for no erythema or skin changes, as well as none of the healthcare professionals on the team had noted any changes in the patient's skin prior to this. So the reason this may be could be due to the fact that the scoring of 1 is characterized by erythema, which this patient wasn't likely to experience due to his darker skin tone. So this just highlights further how our traditional grading system and scoring systems on skin reactions may lead to things like under-recognition of skin reactions in darker skin patients, and this can potentially lead to things like poor patient experiences. So although it's really necessary that our written education is inclusive of patients of all skin tones, it's equally important that the information that we're relaying as healthcare providers also reflects this. So these were just some of those strategies and tools that we discussed in the microlearning sessions for us radiation therapists to help increase the awareness of skin reactions in those patients of darker skin tones. So the first strategy outlined here was ensuring all our patient interactions are personalized. So for us therapists, this means things like our new patient teachings, as well as our daily interactions, making sure that they highlight these differences in potential skin reactions and how they may present based on patient skin tones. So rather than using just terms like redness to describe a skin reaction, also using things like a pink hue, a darkening, so patients know what they could expect during their radiation treatment. And then our second point here has to do with our daily visual skin assessments. So as radiation therapists, we're seeing patients on a daily basis. We're setting up the patient for treatment and uncovering the treatment area. So it's important that we're aware of subtle changes in the patient's skin, so things like coloring changes. And as I mentioned, they may not be as obvious in patients of darker skin tones. So if we don't notice those initial color changes, we should also look out for more moderate reactions, such as areas of dryness. And we also emphasize to the therapist the importance of inquiring into the patient's skincare, so what they're currently doing to manage their skincare, how they think their skin feels, and if they've noticed any changes since the start of treatment. And then we also put in a reminder about documenting objectively. So what is it that we're actually seeing? Is it a redness on the skin, darkening, peeling, oozing, whatever the reaction may be. And then the third strategy we discussed was the dissemination of the new skin reaction booklet. So based on our initial radiation therapist survey responses, we found that we were giving out the previous head and neck pamphlet 44% of the time, and the previous breast pamphlet 31% of the time. And as we know, patients tend to forget a lot of the information that we give to them verbally, so about 40 to 80% of that information. That's why it's important that we also supplement our skincare information in a written format for patients. This is so that they can take it home, read it over with family, as well as reference back to as treatment's complete, because as we know, skin reactions tend to peak after radiation treatment is complete. And then we also discussed, as we're giving these resources and providing recommendations to patients, that we are doing things like the teach back methods to ask patients to repeat back the information that we had told them to make sure that they had understood it correctly. And then the final strategy we discussed here was leading by example. So this would be emphasizing our teachings to, in our case, radiation therapy students, as well as new and incoming grads. They may not be as comfortable when assessing skin reactions in patients of darker skin tones, especially if this is not something that was discussed in their formal education or schooling, because I know it's not something that was discussed for myself. And then another important aspect to note is that both students and new radiation therapists are less exposed to severe skin reactions, so they don't see them as often as things like our treatment techniques improve over time. So after implementing both our microlearning sessions among staff, as well as distributing the updated skin reaction booklet, we redistributed our patient surveys to patients of the same inclusion criteria. And this time we had 33 patients respond to our surveys. So going back to that initial statement that I mentioned earlier, I have enough information to help me manage possible skin reactions that may occur during and or after my radiation treatment. So on the left here is just our pre-intervention graph, and then this is our post-intervention graph. So on the post-intervention, we actually had a lower percentage of patients in the darkest skin tone category, so the C1 to C3, feeling unsure if they had the information they need on skin reactions. So here we went from about 50% of those patients feeling unsure to only about 33%. And we can also see here we had an overall shift of the graph towards the right side, so a higher percentage of patients in all skin tone categories, so A1 to A3, B1 to B3, and C1 to C3, feeling more confident that they had sufficient information on skin reactions. And then for our post surveys, we gave all patients the updated skin reaction booklet so that we could receive some feedback. And then from our post-intervention survey, we actually can see here on the right, we had 100% of those patients in the lightest skin tone category, so the A1 to A3, feeling like the information on how to care for their skin was relevant to them, so they either agreed or strongly agreed with the statement. We had 92% of those patients in the medium skin tone category feeling this way, and then 100% of those patients in the darkest skin tone category, so the C1 to C3, also feeling this way. So we saw an increase noted in both our medium skin tone category, so B1 to B3 patients, as well as an increase in our darkest skin tone category patients, C1 to C3. We noted no changes in the patients of the lightest skin tone category, so A1 to A3, but this is because this group had a baseline relevancy of 100%, so both in our pre and post, so there was no change. So the results from our interventions or overall change in the awareness of radiation-related skin reactions, we had an 8% increase in those lightest skin tone patients, so A1 to A3, a 29% increase in the medium self-reported skin tones, B1 to B3, and a 25% increase in the darkest self-reported skin tone, C1 to C3. So we were able to meet our aim for both the medium and darkest skin tone category patients. As I just mentioned, it might be a little bit lower in the lightest skin tone category patients as their baseline awareness was already higher. So in conclusion, culturally inclusive education can improve patient awareness on radiation-induced skin reactions. So when our patient education is not inclusive, this can sometimes lead to unlikely expectations of skin reactions, especially in those patients with the darker skin tones, and then possibly an oversight in our skincare management and interventions. It's important, as we know, that patients experiencing skin reactions have both adequate and relevant information on how to care for their skin on treatment so that we can minimize things like further irritation, infection, and discomfort. And then from a radiation therapist standpoint perspective, as we see the patient on a day-to-day basis, we know we play a large role in providing patient care. So we can sometimes be those first ones to notice any changes during a patient's treatment. So it's important that we feel confident when we're assessing skin reactions in those patients of darker skin tone patients. So just by adding a few extra sentences during our interactions with patients and updating our resources, we can have a great impact on side effect management in our patients, especially those of the darker skin tones that are undergoing radiation treatment. So after our project was complete, these were some of our efforts for spread and sustainability. So this included one, expanding our microlearning sessions to include the radiation oncology nurses. So this was done last year. The other aspect would be embedding this information in our radiation therapy student patient care sessions. These are held by the clinical coordinators, Marnie and Krista, for the second year students that are transitioning into their last year of clinicals. And then finally, having things like this, presentations that are available on our intranet links, so on SunnyNet, for new and incoming staff to review during things like their onboarding processes. So as for future directions, one thing that we were thinking of doing, and Joka Anderson is actually working on as well, is creating a comprehensive image library or database of skin reactions across diverse skin tones. So we thought this would be helpful for both patients as well as clinicians. Our initial hope with the skin reaction booklet was to add a QR code at the end for patients to scan so they're able to see skin reactions across a variety of skin tones. And then from the literature, we can also see that we need further research on both the biological and molecular differences of skin reactions in darker skin tone patients so that we can update our guidelines and management techniques for these patients. And then finally, updating our educational resources beyond our departmental level. So looking at things such as Cancer Care Ontario and on a national level as well. And also just updating our classification tools on skin reactions, as we mentioned earlier. So for acknowledgements, I do want to acknowledge the TASMP Health Innovations Fellowship and Sunnybrook Practice-Based Research and Innovation. I want to highlight Sarah, Lisa, Nicole, and Angel, who directed this program. And then as well as, of course, my mentors for this project, both Sahir and Darby. I also want to acknowledge the radiation therapy department. So anyone who was part of the project, including leadership, Steve and Donna for helping support the project, Shalina and Stacy, who helped a lot with creating our surveys for patients as well as radiation therapists, Edens, whose work obviously started this project here, as well as colleagues from units 1, 2, 6, 7, and 13, because they helped distribute those patient pamphlets and surveys as well. These were just some of the references.
Thank you, Jugdip. So I would invite anybody who has any questions, feel free to put them in the chat, or you can put your hand up and I will try my best to moderate. There's lots of clapping coming from you, Jugdip. I hope you can see that. I will open it. I just for curious, what are your next steps? What would you ideally like to see next for you in this project?
I think probably, like I mentioned, what we were looking at, creating that database for patients. I think that would be really helpful for, again, for patients to be able to see, because like I said in that testimonial, patients don't really have much to reference. As we know, patients go online a lot to look at things prior to treatment. So it's nice for patients to have something to be able to look at, especially if it's a QR code that's simple and easy. So something that they can look at, their family members can look at as well. So I think that would be helpful. And then also helpful then moving into those next steps, which would be like through oncology, looking at changing those classification tools. So actually grading those images and kind of maybe classifying how we describe a radiation-induced skin reaction.
Excellent. It is a huge gap, well, as we know when we were trying to look for other resources. So I do know Odette has a question, so I'm going to unmute myself so she can ask her questions, and she's sitting beside me.
Hi, Jugdip. Amazing talk. Congratulations on your work so far. Just out of curiosity, was the survey work that you did predominantly English surveys to given to English-speaking patients? And if so, is there a possibility of maybe broadening your patient cohort to those who may not speak English as their first language?
Yeah, I think that's a really good point. Medette, ours was just for patients that spoke English. So we also did sometimes, if there was a family member present who could translate for the patient, but that was really rare in our project. So it would be useful to get feedback and information from patients who don't speak English. I know Dan's project is kind of looking at something similar to this, of looking on how we can include patients that don't speak English into projects like these so that their feedback and their recommendations are being heard as well. So I think that's a really good point, and hopefully we can move towards having things in multiple languages for patients to be able to be included.
Thanks, Jugdip.
Excellent. So we have a question in the chat. Here we go. So from Marie Ambrosio, does skincare management stay the same regardless of skin tone? And is this something you plan on looking into?
So as of right now, like I mentioned, a lot of this was that there's a big gap in our literature. So a lot of the initial studies that were done for patients with lighter skin tones. So there's not enough evidence or data to back up how we should be managing skincare in patients with darker skin tones. So this is definitely something that needs research to be done on. I would love to do something like that in the future, to look into that as well, to see if there's something that we can do to test. I know I was talking to Dr. Edward Chow about one of our physicists, Lee, who's looking into things like spectrometry. So looking at the light that's reflected from the patient's skin rather than looking visually for a skin reaction, to see if that kind of helps us detect them earlier. But in terms of management, I'm not too sure what's out there and if there's anything being done, but it's definitely something to look at in the future.
Excellent. And there was another question in this chat, which is, do all ROs agree on the same skincare management? And I can help answer this.
Yeah, I think that's better suited for you, Darby.
No, and I guess there tends to be subtle differences, though there was just a pan-Canadian Delphi on the management of radiation dermatitis that was published. So by and large, there is national agreement, but you can have some differences in some of the specific interventions. There's a comment and question from Steve, so I will just read to you. Thanks for the amazing work, Jugdip. Has there been interest from the Michener in incorporating this into their curriculum or also CCO?
So we on our end haven't reached out regarding this, but I think it would be definitely something that's important because when we had done the student sessions here, again, students similar to myself don't feel like they were highlighted this stuff. So it would be important for something to include within their patient care sessions prior to them going off to clinicals. So I think that is something that we could look into next as well, is getting Michener as well as, I'm not sure, the McMaster program as well, to add maybe just a slide or two into patient care sessions, and as well as Cancer Care Ontario, because that was one thing that we noticed in our current state. We looked at a few different centers across Ontario. We found that Credit Valley was already kind of using that inclusive language, but if you look into Cancer Care Ontario, they don't have that language in there. They just use redness. So it would be maybe an important thing to branch further into that as well.
Yes, definitely. I can think of a few people that I should be putting you in contact with. And another question, and this is an excellent point from Laurie Legere. I'll read again. Really wonderful work. She may have missed this, but it would be excellent to highlight this at the patient education Zoom sessions for that people attend prior to starting radiation. And I think that is a great point, and we are looking at dates for our next one. And Laurie, we will be sure to include that in just so that for awareness sake. Okay, we're running. Oh, I've got a thumbs up from Laurie for that, so that's good. I'm just scanning to see if there's any hands, if there's any more questions. I don't see anything. Okay, if there are no more questions, I think we can wrap up a little bit early. I will just thank you so much, Jugdip, for your excellent talk and this really, really important work that I know is going to be the foundation to a lot more projects for our department, and wanting to wish you the best of luck when you speak in San Francisco. So thank you and good luck.
Thank you. Thank you everyone for attending as well.
Yes.